So, picture this. A deadly virus, one that's been dormant for nearly 20 years, has just popped back up. A global health alert is out, and you know the race to contain it is already on. But here's the interesting part. The key to stopping this thing might not be found in some high-tech lab. It might actually be hidden in the really painful lessons learned from the past. Let's break down exactly what's happening with this new Nipah virus alert, and why, this time might be different.
Okay, so the whole story kicks off right here with this epidemiological bulletin from the World Health Organization. And look, this isn't just some internal memo. This is the kind of alert that puts public health officials all around the world on high notice, because it signals a potentially devastating outbreak could be on the horizon.
And this is absolutely no routine warning. The alert zeroes in on West Bengal, India. Why? Because 2 suspected cases have emerged of a virus that hasn't been seen in this state since way back in 2007. And let me tell you, the reemergence of an old enemy like this is always a cause for very serious concern.
All right, let's get into our first section, the WHO alert itself. The bulletin is dated January 14, 2026, and it's our first official look at the facts of this potential new outbreak.
So the key details are right here on the screen. 2 suspected cases reported on January 12th. But the most critical part here isn't just the what or the where, it's the how fast. A national team is already on the ground. Surveillance and contact tracing are already underway. That speed, that immediate action, is really the central theme of this whole story.
But to really grasp the urgency here, we need to understand the virus itself. What is Nipah, and why does its name alone trigger such a serious, rapid response?
So, Nipah, or NIV as it's called, is a zoonotic virus. All that really means is it's a virus that jumps from animals to humans. In this case, its natural home or reservoir is the fruit bat. Now, you could get it from something as simple as eating a piece of fruit that an infected bat has drooled on. But, and this is the crucial part, it can also spread directly from person to person. That's what makes it so incredibly dangerous in a community setting.
And this is why Nipah is so feared. During a major outbreak in India back in 2018, the case fatality rate was a staggering 89.4%. Let that sink in. Nearly 9 out of every 10 people with a confirmed infection did not survive. And what makes it even scarier is that there's no vaccine and there's no cure. Treatment is pretty much limited to just supportive care.
Now, that devastating 2018 outbreak took place in the Indian state of Kerala. And to really understand the lightning-fast response we're seeing in West Bengal today, we have to look at Kerala's long, hard-fought history with this exact virus. They have, tragically, become the world's experts.
This timeline, it shows a really painful but incredibly important pattern. After that horrific 2018 outbreak that killed 17 people, Kerala was hit again and again. But look what happens. With each new encounter, in 2019, 2021, and 2023, the response got faster, it got more targeted, and way more effective at stopping the spread. They were literally learning in real time, under the worst possible circumstances. But these lessons, they came at such a profound human cost. Back in 2018, a 28-year-old nurse named Nipah treated the very first patient before anyone even knew what they were dealing with. She caught the virus, and she died, leaving a heartbreaking note for her husband. She became this international symbol of the sacrifice healthcare workers make, and she was even honored by the director of the WHO.
So here's the crucial point. Out of all that tragedy, out of that repeated struggle, Kerala forged a battle-tested playbook. They built a system from the ground up for confronting one of the world's deadliest viruses. And that system is built on 2 things: speed and precision. And here it is, the core of their strategy. It all starts with speed, identifying cases and getting tests done fast, so you know what you're fighting. Then you get super aggressive with contact tracing. You build a map of the virus's potential path by finding every single person who might have been exposed. Step 3, you break the chain of transmission with strict quarantine and isolation. All of this has to be coordinated perfectly across all levels of government, and this is so important, it's backed up by clear, honest communication with the public to stop panic and build trust. And their commitment to being prepared didn't just end with the plan on paper. Oh no. In response to these outbreaks, Kerala established a permanent, state-of-the-art Institute of Advanced Virology. Think about that. This is a lasting legacy. They turned the reactive lessons from a crisis into a proactive, permanent shield for the future. Which brings us right back to where we started, those 2 suspected cases in West Bengal.
How exactly does Kerala's hard-won experience shape what is happening there right now in this new emergency?
Well, the connection is direct, and it is powerful. Kerala's experience is what wrote the playbook. And now, in West Bengal, we are seeing that playbook being put into action, in real time. The immediate deployment of a national team, the instant ramp-up of surveillance, the immediate contact tracing, these aren't just improvised, panicked measures. This is the direct application of lessons learned and paid for on the front line.
And that leaves us with this final, really critical question. The events unfolding in West Bengal are a real-time test for all of us. As these deadly new and re-emerging viruses continue to threaten the world, the race is always going to be against the clock. So the ultimate challenge is this: can we apply the hard-earned lessons of the past faster than the viruses of the future can spread?